Hi, Annie.
Hello.
Hi, my name is Bridget. I'm going to be one of the nurses of Dr. John Smith.
Okay.
Today I'm going to be performing the head-to-toe assessment on you, okay?
All right.
It shouldn't cause you any pain. However, if it does, you need to let me know.
Okay.
So first off, I'm just going to wash my hands real quick.
Oh, good.
So I know that they obtained a height and weight on you, so I'm going to go ahead and get blood pressure and also check your heart rate as well.
Okay.
Now, does any high blood pressure run in your family or?
Yes.
Okay. And who has that?
My mom and my grandpa.
Okay. So it's something, that potentially we'll need to be checking periodically for you. And every visit, we always check your blood pressure anyway, so. I got 124/84. Now, just to let you know, borderline hypertension, I know they kind of change the levels of the hypertension quite often. So I wanted to let you know that borderline hypertension is about 120 to 139 systolic. So you're about a 124.
Okay.
Diastolically, it's between 80 and 89, and you were 84. Okay. So that's something that definitely we're going to want to be checking.
All right. Sounds good.
Okay. Now I'm just going to I'm going to get your heart rate here. And I got 72, and that's great. You want between 60 and 100.
Okay.
Also, while I was obtaining your heart rate, I was also checking her respirations. Yours were 18, and you wanted between 12 and 20. So that was perfect.
Good.
So during this head-to-toe assessment, what we kind of do is just work from your head down to your feet. Are you having any pain right now?
No.
Okay. Now, we always try to establish a comfort goal for our patients as well. Now, 0 means no pain at all, and 10 means, most severe pain. What would you establish your comfort goal at?
A 4.
Okay. But you currently have no pain at this time?
Correct.
Okay, great. When you experience pain, do you take just over-the-counter Tylenol or Motrin?
Yes.
Okay. And that seems to help with the problem?
Yes.
Okay. So I noticed as she was walking in, she had really good posture. She seems to be sitting upright. She seems to be alert to the conversations that we're having, and she's able to have a conversation back with me. Can you tell me the date?
Monday, December 8th.
Is it morning or afternoon?
It's afternoon.
Okay, perfect. All right, so like I said, I'm going to check, start with your head and go down to your feet. Are you having any shortness of breath or anything like that currently? No. Great. Okay, your scalp appears to be normal. Any abnormalities that you've noticed? Any moles or anything like that in your hair?
No.
Good. Have you ever had lice or anything like that?
No.
Okay, great. Now I'm going to go ahead and check your ears. Let me just grab my pen light here real quick. Do you have any pain or discomfort in your ears, like when I'm touching or anything? Okay.
No.
I'm just going to pull your pen forward. Any pain there?
No.
Okay. Now I'm just going to check in your ears to see if I see any drainage or earwax, anything like that. No drainage, noted. Any pain when I'm touching or anything like that? No? Okay. Any pain when I pull your pin up?
No.
Okay. And let me just check for drainage and redness in this ear as well. Alright, I'm not seeing anything. Any difficulty with swallowing or anything like that? Okay. I'm going to check your nose. Have you ever had your nose broken or anything like that?
No.
Okay. Any nasal drainage, or I know it's that time of year, everyone's kind of got that. No? Okay. I'm just going to feel around on your neck here. Nothing with your thyroid, you don't take any thyroid medication or anything? Okay,
No.
that all appears normal. Can you smile for me? Great. Can I see your gums as well? Do you go to the dentist regularly?
I do.
Great. When was the last time you went?
It was about 5 months ago.
Okay.
So
Do you usually go every
yeah,
6 months
I
or
do.
so?
I need to make an appointment.
Okay. All right, I'm going to have you open up your mouth. If you could say, ah. All right. It looks like your upper palate and everything looks great there. Let me just look under your tongue too, because that's a place that a lot of people forget to look at, and we can check for abnormalities under there as well. All right. You said no difficulty with swallowing or anything like that, correct?
No.
Okay. Now I'm going to kind of check out your eyes. I'm going to use this pen light to check for constriction and dilation of your pupils.
Okay.
So I'm just going to have you look straight ahead, and I'm going to see how your pupils constrict. All right, great. Think about from a 4 to a 3.
Okay.
Now I'm going to just do a indirect. And what I'm going to do is put my hand in the middle of your nose and then use the light to check your pupils as well.
Okay.
Now, do you go to, do you wear contacts or glasses or anything like that?
I only wear glasses when I'm reading.
Okay. So and that seems to be going okay? You go see your eye doctor regularly?
I just went like 2 weeks ago.
Okay, great, great. All right, now I'm going to check your 6 fields of gaze. So I'm just going to have you follow this pen light for me. Okay? Great. Looks like you have everything's normal there. Didn't see anything odd with your eyes. Just make sure you continue to follow up with your eye doctor if you have any concerns or any difficulty there.
Okay.
All right. And you said you're not having any difficulty with breathing or anything like that?
No.
Okay, great. Let me just check your shoulder strength here, and then I'm going to go ahead and listen to your heart sounds.
Okay.
So what I'm going to do is put pressure on your shoulders. If you could just push up. Okay, great. Give really good muscle strength, about a 5+, so that's good. That's what we want to have. Let me check your skin and your capillary refill as well. I don't see any abnormalities. Your skin's nice, dry, pink. Okay. I'm going to check your capillary refill. This checks for circulation. And it's about 2 to 3 seconds, and that's exactly what you want. I'm going to check for skin turgor as well. And what you want to look for is tinting. So if your skin would not go back down to what it's supposed to be, then you might be dehydrated. Now, as a nurse, do you drink plenty of water?
No.
No? Okay. So you want to just make sure you're drinking 6 to 8 glasses of water per day. Okay. Make sure you're staying hydrated.
Oh, okay. That seems like a lot.
That is a lot, but that's the recommendations now.
Okay.
Alright, so now I'm going to listen to your heart sounds. And this will take a little bit. I'm going to use both the diaphragm and the bell of my stethoscope. Okay?
Alright.
So first I'm going to use the diaphragm of the stethoscope, and I'm going to just work my way around. So first off, I'm going to listen to the right second intercostal space. Now the third. The fourth. And then the fifth. And in some women, you might have to lift up their breasts, so just make sure if that happens, you just want to make sure that the woman is aware that that's what you're going to be doing as well. Then I'm going to go ahead and listen with the bell of the stethoscope. And so far, I'm hearing the normal heart sounds of S1 and S2, a lub-dub sound, and that's exactly what you want to have. I don't hear any murmurs or anything like that. So the third intercostal space. The fourth. and then again the 5th. All right, great. And those sound both normal with both the diaphragm and the bell of the stethoscope.
Okay.
Next, I'm going to listen to your lung sounds. And what I'm going to have you do is take deep breaths in and out. If you start to feel short of breath, you need to let me know. Okay? Another breath. Another. Okay, great. And while I'm got my stethoscope out, I'm going to go ahead and listen to your apical pulse, which is just right underneath, for a full minute, okay?
Mm-hmm.
All right, great. That's exactly what you want to hear. It's in 74, and that sounds great. And what I did is I listened to her apical pulse for 1 full minute. All right, so now I'm going to listen to the posterior parts of your lungs, okay? Deep breaths. Okay, great. I do not hear any wheezing or crackles or anything like that, and that's exactly, we're checking for, especially this time of year when kind of got that cold and cough. Have you been experiencing any cough or
No.
productive cough or sputum or anything like that?
No.
Okay, great. All right, now I'm going to check, I'm going to percuss your lungs just in your posterior. This might feel kind of abnormal or odd to you, so just let me know if you have any pain from it, okay?
Okay.
All right. I didn't hear any dullness or anything like that. All I heard was the resonance sound, and that is normal. That's what you want to hear. If you hear a dullness or anything like that, we might think it was a mass or something, so that we heard the right things there. Now I'm going to check for, I'm going to listen to your bowel sounds, and I'm going to check for any tenderness or anything in your bowels as well. Now, when was your last bowel movement?
Yesterday.
Okay. Any constipation or diarrhea or anything like that?
Constipation.
Okay. Do you take anything for constipation?
I take fiber pills and probiotics, and sometimes I have to use laxatives.
Okay. Okay. Do those seem to work well for you?
Yeah.
Okay. That's great. Now I'm going to listen to each quadrant for approximately 15 seconds. And I heard about 5 gurgles in each quadrant, so that is normal. When did you last eat?
About 5 or 6 hours ago.
Okay, okay. So you'll probably be getting hungry or soon, so your bowel sounds might be more hyperactive. Now I'm just going to check on your stomach and see if you have any tenderness. And if you do, just please let me know, okay?
Mm-hmm.
So no tenderness or anything?
No.
Okay. And I don't notice any abnormalities in her stomach. She appears to have a convex stomach, no striae or anything like that noted. Her skin is warm, tacted, and pink as well. All right. All right, now I'm going to check out your lower extremities. Do you have any open areas or anything on your skin,
No.
or moles or anything on your feet or
No.
anywhere like that, or bruising? Great. So your skin looks good. I'm going to check for muscle strength. If you could just push against my hands. Perfect. And now pull back. Great. Really good muscle strength there. Any numbness or tingling
No.
Okay, great. Any swelling in joints or anything in your feet?
Only after I work 12-hour shift.
Okay. Do you have a good pair of shoes? Or
Yeah.
Okay, that's good. So maybe just when you get home, elevate your feet a little bit, especially after being up for 12 hours. That's definitely understandable.
Okay.
Also, do you exercise?
No.
Okay. So exercise might be something too that would help with your constipation.
Oh.
You could take it for, exercising 20 minutes, 2 to 3 times a week would be something that you might want to do.
I should do that.
Okay. Now I'm just going to check, I'm going to palpate all of your pulses.
Okay.
So first I'm going to start with the Okay, great. I'm going to check your brachial. Your femoral, and this might be uncomfortable for some patients, so just, as best as you can. It might be easier if the patient was laying down. I'm going to check your popliteal pulse. And this can sometimes be hard to find. You might want to have the patient, move their leg up and down until you can find that pulse. Then I'm going to check the posterior tibial pulse.
You're supposed to have this on here.
All right, all of her pulses seem to be normal. They're bounding, and I don't notice any abnormalities at this time. Now, one last thing I'm going to do is check for pulse deficit, okay? Now I'm going to listen to your apical pulse and also to check for any abnormalities, okay?
Mm-hmm.
And I've listened to this for approximately 1 minute. All right. Do you have any questions or concerns, Annie, at this time?
No, I don't.
Any safety concerns or anything in your house?
No.
No? Okay. Well, that should conclude my assessment. So if you don't have any more questions, I'll let you go ahead and go.
Okay.
All right. Thank you.